Welcome to Medicare 101. My name is Christine Carter Naff, and I'm a licensed sales representative representing Medicare health insurance plans. I'm a broker, and I own KCN Benefit Advisors, LLC. Today's presentation is in partnership with Walden Insurance Services and the Everett Clinic. What should you expect today? I'll make sure that you understand the basics of Original Medicare. We'll talk about the Medicare costs, what your premiums and out-of-pocket costs could be. We'll talk about the 4 different parts of Medicare, A, B, C, and D. And I'll make sure that you understand your enrollment timing, as well as what you should expect throughout the year. Again, my name is Christine, and I'm a career Medicare health insurance agent. I spent the last 15 years helping my clients choose their health plans. As a broker, I'm able to offer multiple insurance carriers and multiple plans, and I represent all plans available at the Everett Clinic. Medicare is the federal health insurance program for people 65 and over, under the age of 65 with a qualifying disability, or with the diagnosis of end-stage renal disease, or ALS, also known as Lou Gehrig's disease. You do need to be a U.S. citizen or a legal resident, and you must have lived in the United States for at least 5 years in a row, including the 5 years just before applying for Medicare. What does Medicare cover, and what are my out-of-pocket costs? Original Medicare is broken into 2 parts, Part A and Part B. Part A is your hospital insurance, which will cover your hospital stay and inpatient care, as well as skilled nursing care, which is a rehabilitation hospital, home health care, and hospice care, which is end-of-life care. Part B is your medical insurance, covering you for your doctor's visits and your outpatient care. Your Medicare health insurance card will have your name, it will have your Medicare number, and it will also have your start dates or effective dates for your Part A coverage and your Part B coverage, as shown here on the screen. Medicare Part A is your hospital insurance, and it's going to cover you for your hospital stay and your inpatient care, to include things like your room and board, special care units like intensive care, or your operating room and recovery room services. It will also care for skilled nursing services, which is going to be a rehabilitation hospital. It will help for things like home health care if a nurse is needed to come to your home. Also hospice care, which is end-of-life care. If you have worked 10 years or more in the United States, or 40 quarters, and have paid into the Medicare cost system, you will not have a premium for your Part A coverage. You do, however, have a deductible. That's $1,408 for 2020, and that is per benefit period, which is up to 60 days. If you are in the hospital beyond 60 days, you could have additional costs. And do note there is no out-of-pocket limit for Part A, meaning that if you do have a high usage of hospital services, you may have a lot of out-of-pocket costs for that calendar year. Medicare Part B is your medical insurance. It's going to cover things like your doctor's visits, your specialist visits, your lab work, your x-rays, physical therapy, maybe a diabetes screening or a preventative service like a flu shot, or maybe a visit to the emergency room. For 2020, most people will pay $144.60 per month for their Part B premium. If you are drawing Social Security, that premium amount will be deducted automatically from your Social Security. If you are not yet drawing Social Security, there will be other payment methods for that premium. Additionally, for Part B, you will have a deductible annually of $198. After that deductible has been met, Medicare will share costs with you 80-20. Medicare will pay 80% of Medicare covered services, and you will pay 20%. Additionally, Part B does not have an out-of-pocket limit, just like Part A. So if you do have a high usage health year, you may have quite a bit of out-of-pocket costs. Again, you may wish to look for additional insurance to help control those costs. While Medicare Parts A and B do cover most medical procedures, do remember that you will have out-of-pocket costs associated with your care. Additionally, Medicare doesn't cover everything that you may need for your daily health care, such as prescription drugs, preventative dental, routine eye exams, or hearing exams. Additionally, Medicare doesn't cover items like eyeglasses or hearing aids. Also, Medicare does not cover long-term care or custodial care, which is assistance with bathing, eating, or dressing. Also, unless you have an additional Medicare health insurance plan, Original Medicare will not cover care outside of the U.S. except for certain circumstances. Now that you understand the basics of Medicare Parts A and B, now it's time to look at some additional options to help cover those out-of-pocket coverages. There are two different ways that we can help offset those out-of-pocket costs for you and perhaps add additional coverages that Original Medicare does not cover. Option 1 is utilizing a Medicare supplement plan and adding in a standalone prescription drug plan. Option 2 is utilizing a Medicare Advantage plan, which is a plan that may include Part D prescription drugs for you. Let's take a moment and look at option 1 to start. A Medicare supplement plan, also known as a Medigap plan, is a private insurance plan that you purchase to help offset some of the out-of-pocket costs by Original Medicare Parts A and B. It cannot be used with a Medicare Advantage plan, and the federal government does standardize each of the plans available to you in your state. A Medicare supplement plan can be good for people who need to have the ability to be flexible with their care. Maybe you snowbird into a different state and you need to be able to see doctors in different states. A Medicare supplement plan does not have any referral requirements. However, just know that sometimes doctors, depending on their subspecialty, may still require a referral. A Medicare supplement plan can be good for people who want to know exactly what their fixed costs are. But do know that Medicare supplement insurance can be somewhat costly, so if budget is in mind, it may not be the best option. Depending on the Medicare supplement plan that you choose, the plan may help pay for your Part A and Part B deductibles. It may help cover you for your out-of-pocket costs with co-pays, co-insurance, or excess charges. Medicare supplement plans are standardized by the federal government. So that means it doesn't matter which company that you purchase them from. A Plan N or a Plan G from any company will all be covered the same way. Plans also can offer some additional coverage for foreign travel, like emergency care outside of the U.S. But all Medicare supplement plans still adhere to what Original Medicare covers, which means a Medicare supplement plan will not cover you for things like routine dental or routine eye exams. Now, if you do have a concern for your eyes, let's say you need to see a specialist because of macular degeneration or glaucoma or cataracts, that's all going to be covered. But a routine eye exam, let's say for a prescription for eyeglasses, would not be covered with a Medicare supplement plan. Additionally, a Medicare supplement plan will not offer any additional benefits to Original Medicare like long-term care or custodial. Because Original Medicare and a Medicare supplement plan does not cover prescription drugs, let's take some time to look at a Part D prescription drug plan. Medicare Part D for prescription drug coverage is offered by private insurance companies. A prescription drug is a drug that's self-administered, meaning that you go to the pharmacy or have it delivered to your home and you self-administer that prescription. A medical covered drug, like chemotherapy, for example, or infusion therapies, fall back under your medical Part B as in boy coverage. These are specifically prescriptions that the doctor writes for you that you self-administer. You can have a prescription drug plan either as a standalone plan or as part of a Medicare Advantage. So now as we begin to discuss prescription drug coverage, or Part D of Medicare, let's look at some definitions. Each plan will have a drug list, also known as a formulary, and this is a list of all of the drugs that are covered for that plan. Each plan can have its own drug list and can be different. So it is important, as you're looking at prescription drug plans, that you ensure that your prescriptions are covered by the plan that you are choosing. Additionally, this list of drugs is broken up into tiers or groups of different types of drugs according to their cost. As below, you will see that for the most part, they are broken into 5 main tier groups. Tier 1 are your preferred generics. Tier 2 are generics, and those 2 tiers tend to be lower cost prescriptions. Next, you will have Tier 3 preferred brand name drugs and Tier 4 non-preferred drugs, which tend to be a little bit more costly. Finally, you will have Tier 5, which are specialty drugs and tend to be the highest cost. Now we will look at the 4 different stages of prescription drug coverage. Again, regardless if you get your prescription drug coverage as a standalone plan with your original Medicare and your Medicare supplement plan, or as part of a Medicare Advantage plan, all of the plans will work the same way as Medicare defines the individual coverages. We will go through each individual stage, 1, 2, 3, and 4, in the next slides. Stage 1 is the annual deductible. Not all plans have prescription drug deductibles, and many of them, if they do have a deductible, will not have deductibles beginning with Tier 1 or Tier 2 generics. Remember, those are your lower cost prescriptions. Some plans do have a deductible beginning at Tiers 3, 4, and 5. Do understand that if your plan does have a deductible, you will pay the full price of your prescription until you reach that deductible amount. If your prescription drug plan does not have a deductible, or if you're taking prescriptions such as Tier 1 or Tier 2 generics and your plan does not have a deductible for those tiers, you will start with Stage 2, the initial coverage, with your first prescription. Stage 2 is your initial coverage, and that begins new every January 1st or when you begin Medicare. For 2020, you have an initial coverage amount of $4,020. Think of that as like your piggy bank for prescription drugs. When you go to the pharmacy and you pick up your prescription, you will pay a copayment or coinsurance depending on what type or tier that drug is. The amount of money that comes out of your piggy bank, that $4,020, is what the actual cost is of the drug, not just what you are paying. So, for example, let's say you pick up a prescription and your copayment is $5. But let's say the actual cost of that drug is $20. $20 deducted from your $4,020 will leave you with $4,000 in your coverage amount. As you go through the calendar year, if the total cost of your drugs does not exceed $4,020, then you stay in that initial coverage stage through the end of the year. If, however, you use up that $4,020, you do move to the next stage, Stage 3. Stage 3 is the coverage gap, also known as the donut hole. In 2020, if you have used up your initial coverage amount of $4,020, you will move into the coverage gap and you will now pay 25% of the cost of your brand name drugs or 25% of the cost of your generic drugs. You will stay in the coverage gap stage until one of 2 things happens. You either reach the end of the calendar year where we start all over again, or if the cost of your prescriptions are such that your total out-of-pocket costs reach $6,350, then you will move to Stage 4, which is catastrophic. Stage 4 is your catastrophic coverage. At this point, insurance will step back in and pick up approximately 95% of the cost of your prescription drugs until the end of the calendar year. You will pay a small copay or coinsurance during this stage. If you receive extra help from Medicare for your Part D prescription drug costs, do know that the Part D deductible and the coverage gap will not apply to you. Extra help from Medicare is for people with limited incomes, and if you think you might qualify or would like more information, I will have a slide here later in the presentation for that information. Do note also that when you're calculating total drug costs or out-of-pocket costs, these costs will not include any plan premiums if your plan does have a premium. Also, do know that all Part D drug plans, regardless as if they're standalone or part of a Medicare Advantage plan, will start all over again every January 1st. Now we will look at option number 2, choosing a Medicare Advantage plan. A Medicare Advantage plan is offered by a private health insurance company and could be a good choice for you depending on your health insurance needs. Medicare Advantage plans are offered by private health insurance companies, and they combine the coverages of Part A, your hospital coverage, and Part B, your medical coverage, in one plan, and in most cases include prescription drug coverage also. You do have to have Medicare Parts A and B in order to have a Medicare Advantage plan. Part C Medicare Advantage plans are another way to receive your Medicare benefits. You still have Medicare Parts A and B, and you're still paying your Part B premium. But now, instead of the federal government administering your benefits, a private insurance company will. All Medicare Advantage plans must cover everything that Medicare covers, but they can add in some additional benefits to you. Medicare Advantage plans, however, are based on the county in which you reside, so the plans that are available to you are based on your county of residence. Additionally, you may not have end-stage renal disease as a pre-existing condition in order to enroll in a Medicare Advantage plan. Medicare Advantage plans do cover all of the benefits of original Medicare, so you're not losing any benefits from Part A hospital coverage or Part B medical coverage when you enroll in a Medicare Advantage plan. Hospice care, regardless of which plan you choose, will always be covered under your Medicare Part A benefit. Again, most Medicare Advantage plans do include prescription drug coverage. However, it is important that you do understand that every Medicare Advantage plan can have a different formulary or list of covered drugs. So it's very imperative that you check with each plan that you're looking at to ensure that the prescriptions that you're taking are covered under that plan's formulary. Many Medicare Advantage plans will offer additional benefits that Medicare doesn't cover, like maybe eyeglasses or preventative dental exams, hearing tests, or even a gym membership. All Medicare Advantage plans have an annual out-of-pocket maximum or a cap or stopping point for your spending, so you know what your worst case scenario would ever be in a calendar year. So what type of Medicare Advantage plans are there? One kind is a health maintenance organization, also known as an HMO. With an HMO, you're working with a network of doctors. You will have a primary care doctor that will help direct your care, and you will obtain referrals to see specialists within that network. Outside of that network, you would have urgent care and emergency care, such as if you were traveling outside of the service area or in another state. A preferred provider organization, also known as a PPO, also has a network of doctors to work within, but it gives you access to care outside of that network. Do understand, though, when you're utilizing a PPO, if you are using out-of-network care, you will usually pay a much higher out-of-pocket cost or higher co-insurance to using that same care than you would in a network. Point-of-service plans allow you an HMO base, but give you some out-of-network options. And special needs plans are plans that are geared to specific groups of people, maybe people with specific health conditions or people with specific low-income status. There are other types of plans not currently available in Washington State, and those are private fee-for-service plans and medical savings account plans. So which should you choose, a Medicare supplement plan or a Medicare Advantage plan? Well, that's a very individual decision. When you're looking at a Medicare supplement plan, just understand that a Medicare supplement plan in most cases will not offer any additional benefits to that original Medicare coverage, whereas a Medicare Advantage plan may offer you additional benefits, like that gym membership or those eyeglasses. With a Medicare supplement plan, you do have the flexibility of receiving care anywhere in the U.S. With a Medicare Advantage plan, you may need to stay within a provider network. Medicare supplement plans, remember, do not cover prescription drugs. You do need to have a standalone prescription drug plan. A Medicare Advantage plan, however, may include that prescription drug coverage for you. When you're looking at costs, a monthly plan premium is going to be a fixed amount with your Medicare supplement plan. You may additionally then have a premium for your prescription drug plan, and depending on which plan you will have some potential out-of-pocket costs. With the Medicare Advantage plan, some plans don't have any additional plan premium outside of your Part B premium that you're already paying. Some plans include that prescription drug coverage at no additional cost also. You will pay a co-payment or co-insurance for most of your covered services. And you do know what your annual out-of-pocket maximum is going to be, so you know what your worst-case scenario will be in a catastrophic health year. From a convenience standpoint, Medicare supplement plans can be pretty flexible, but again, you're paying an extra premium for that flexibility. A Medicare Advantage plan is going to be an all-in-one plan, so it's more of a package type plan for you. So let's now talk about your timing. When should you enroll, and what are the different election periods throughout the year? If you are turning 65 and you're still working, and you're utilizing an employer health plan that is creditable, meaning it's as good as or better than Medicare, and you are not yet ready for your Medicare, you are able to delay taking your Medicare until the time that you decide to retire. Please do check with your benefits department with your employer to ensure that your plan is as good as or better than Medicare. Otherwise, if you are turning 65, your Medicare begins on the 1st of your birthday month. So if you were born on September 15th, your Medicare would begin on September 1st. If you're born on the 1st of the month, you actually then will start the month prior. So if your birth date is September 1st, you are Medicare eligible beginning on August 1st. Your initial enrollment period are the 3 months prior to your 65th birthday month, your birthday month, and then the 3 months after your 65th birthday month. If you've been disabled for 24 months or more, you will also be automatically enrolled into Medicare for that 25th month. You're able to enroll yourself, if you'd like to, on ssa.gov, which is the Social Security Administration website, or you can contact Social Security, and I have more contact information for you here in the next few slides. You will have a special enrollment period available to you if you've worked past age 65. So do not worry about having a Part D or Part B penalty for late enrollment. Again, please do check with your benefits specialist with your employer to ensure that your plan is creditable and will count as Medicare coverage until you do decide to move to Medicare. Once you do decide to move to Medicare, you will have a special enrollment period that will allow you to enroll in either a Medicare supplement plan with a prescription drug plan or a Medicare Advantage plan with a prescription drug. If you do not enroll in Medicare Parts A, B, or D when you are first eligible, or if you don't have additional qualifying insurance like through an employer plan, you could be subject to a late enrollment premium penalty. These penalties are assessed by Medicare. If you have questions on your timing, please feel free to ask me, or I have a few contacts here in a few more slides for you to help make sure that you're not going to be subject to any late enrollments and that you're going to be doing everything on time. So when can I change my coverage? Every year you have the opportunity to make changes to your Medicare health insurance plans, and that is called the Medicare Annual Enrollment Period, which runs every October 15th through December 7th. During this time, you can make multiple plan changes. You can change from original Medicare to a Medicare Advantage plan. You can add a prescription drug plan. You can change from Medicare Advantage to Medicare Advantage, or you can add a prescription drug plan and a Medicare supplement plan. If you're happy with your plan, however, and you do not want to make any changes, you're not required to, and the plan will automatically renew for you each January 1st. For people who are utilizing a Medicare Advantage plan, you will have one additional Medicare Advantage open enrollment period that runs every January 1st through March 31st. During this time period, you have the ability to move from Medicare Advantage plan to Medicare Advantage plan, or go from a Medicare Advantage plan back to original Medicare, and if qualified, add a Medicare supplement plan or add a prescription drug plan. During this time period, however, you're only able to make one change. Once we get to April 1st, you are unable to make plan changes until the next fall enrollment period, or if you have a special election period. A special enrollment period is a qualifying life event that will allow for you to make a plan change mid-year. In most cases, you will have approximately 2 months or 63 days to make these plan changes depending on your qualifying life event. Such events could be things like moving out of the service area to a different county where your plan is not available, or maybe to a different state. Or maybe you've lost employer coverage, or maybe you now qualify for a special needs plan. Possibly it's because you have financial help from Medicare and that has now opened a new special window for you to look at different plans. Please do know that special enrollment periods do have a time limit, so make sure that when you're looking at special enrollment periods for your qualifying events, that you ensure that you're making your plan changes within that time allotment. Here is some contact information for you so you can get a hold of Medicare and Medicaid for your state. Here are some more resources for you, to include the Medicare website where you can receive more information on plans, and you can also find out what's covered and not covered by Medicare. You can go to medicare.gov or you can call 1-800-MEDICARE. If you do wish to enroll online for your Medicare, you will actually do that at the Social Security website, and that is at www.ssa.gov. Again, that is www.s as in Sam, S as in Sam, A as in Apple.gov. If you have a limited income, you may be eligible for extra help for like the cost of your prescriptions, your health care, or even your Part B premium costs. You can contact your state Medicaid office, Medicare, or I would be happy to help you to see if you qualify for any financial assistance programs. Thank you so much for taking the time today to go over this valuable information. I do know that this information can be a bit overwhelming and you probably still have questions, and I'm here to assist you. There's no cost or obligation. We can have a one-on-one appointment via the phone, over the email, or over the web. And if you do need help determining if you qualify for financial assistance programs, I can help you do that too. Also, we can talk about which plans will work best for you, and I can help you enroll in those plans. There's no cost or charge for my services, but I may be compensated by the insurance plans. Please feel free to contact me at email Christine@KCNBenefitAdvisors.com, over my cell phone at 425-344-7663, or at my toll-free number at 1-866-788-5764.